Are IVF babies healthy? Studies have shown that IVF babies are generally as healthy as those conceived naturally. According to the American Society for Reproductive Medicine, IVF is associated with a slightly increased risk of certain birth defects, but the absolute risk remains low. Some of the birth defects that have been linked to IVF include heart defects, cleft lip and palate, and gastrointestinal defects. However, the risk of these defects is still relatively low, with only a small increase over the general population. One of the reasons for the increased risk of birth defects in IVF babies is that some couples who use IVF have underlying fertility issues that may increase the risk of birth defects. However, research has shown that the risk of birth defects is similar for couples who use IVF because of male factor infertility, female factor infertility, or unexplained infertility. Other factors that may affect the health of IVF babies include the age of the mother and the number of embryos transferred. Older mothers and those who have multiple embryos transferred may be at a slightly increased risk of certain pregnancy complications, such as preterm birth and low birth weight. It is important to note that IVF clinics have strict guidelines and regulations to ensure the health and safety of both the mother and the baby. These guidelines include screening for genetic disorders, monitoring the development of embryos, and limiting the number of embryos that can be transferred. In conclusion, IVF is a safe and effective way for couples to have a child. While there may be a slightly increased risk of certain birth defects and pregnancy complications, the overall health of IVF babies is similar to those conceived naturally. IVF clinics follow strict guidelines to ensure the health and safety of both the mother and the baby, and ongoing research is being conducted to monitor the long-term health of IVF babies. If you are considering IVF, it is important to discuss any concerns with your doctor and to understand the risks and benefits of the procedure. Are IVF babies healthy? Studies have shown that